I'm going to discuss sports hernias versus inguinal hernias today, and this is a topic that a lot of you have been searching for. I'm sure of it because we've gotten questions about it. And there's a big misconception about the two, so I will go into full detail today about how to figure out, basically, well, I don't know if we'll be able to figure it out, but I think the conversation is it needs to be had, because a lot of times you'll go to the doctor's office and we don't know, we or that clinician, your clinician, might not have time to discuss it all. So hopefully this video, if you stay along to the very end, you'll understand the difference between the two. Now, if you want help with things, you can always reach out to us. We do invite you to come in person, or we have online options. A lot of times with sports hernias, we don't need to be there in person to help you. Groin pain, hip pain, low back pain, we don't need to be there to help you. We just have to give you suggestions to do. Okay? Does it change the outcome? No, it's actually fine. We have a lot of people who have really succeeded with online types of care with us, and it's been perfectly fine. So if you're interested, just go to the link below, go to our website, and or email us, ask us questions, whatever. Okay, so by the way, I guess I should always tell you that I'm one half of the locally world famous chiropractors. I know locally world famous. It's an ongoing joke. So an inguinal hernia is different than a sports hernia, mainly because the sports hernia is not really a hernia at all. I don't know why it's being called that, but it's basically a tear or a fray. And the tear or a fray has nothing to do with digestion or intestinal contents. It has to do with, it's called the transversalis fascia. And so the transversalis fascia, so we have I'll just show you on myself. The common area for the sports hernia is going to be, if you take your hand right here on the fleshy area and slide it down, there's a bony area, slide your finger down to another bony area, it's about 1 inch and out, right around here, and you will not feel any protrusion of anything outwards, whether you're bearing down, holding your breath, bending backwards, going to the side, you won't feel anything start to expose. And sports hernias typically don't have anything to do with digestion. It doesn't have anything to do with if it hurts when you ate. But it can hurt when you pick up an object sometimes, because there is still an insufficiency of the abdominal wall. By the way, there's a lot of reasons for groin pain. This is just one. And so if you have questions about the other ones, just go to our little red button here and go to our channel. So subscribe, go to the channel search function, and just put up sports hernia or groin pain. There's a lot of different reasons. Sports hernia is just one. Honest to God, of the people who come in with groin pain who feel like they have sports hernias, most of them have other things like FAI or low back referral. Sports hernias are possible, but they're not probable. Okay. Now, if we're talking about a inguinal hernia, especially of different sizes, you'll start to feel abdominal contents come out or a protrusion come out. Sometimes it goes into the scrotum. Other times it just feels like a bulge in the area. And so I'm going to pick up, this is a Netter's book. Okay, this is something that we use for school. And so here we have, if you look up here, this is the abdominal this is the part of the intestines. It's going to go down through this little tunnel that has been created by a tear, and it goes down into, this is actually part of the ring or the canal that goes into the scrotum, okay? And so this doesn't have to go all the way through. In this case, it moves in and out a little bit. It can be kind of up in here in its basic stages, but it can go down and it can feel like your scrotum is actually enlarged. If you're a woman, obviously it's a different story, but you can still feel a fullness right there. And the fullness is something you should definitely have an ultrasound to investigate and have the clinician feel on you to feel what's going on. If the hernia, if it is actually an inguinal hernia where it's a true hernia, not a sports hernia, a lot of times that's a surgical intervention most of the time. And I'm not the expert in that, but I know how to send them out. And so we know that that's not something that's going to really respond to a rehabilitation type of approach, or even, like massage or chiropractic or anything like that. So usually we refer those ones out. But the major difference is that there'll be digestion will affect it. Also, you'll notice the fullness, that it'll feel like swelling. And if you're a man, it'll sometimes descend into the scrotum, okay? Sometimes people feel a tightness or tingling in their scrotum associated with either one of them, okay? And this can happen because there's nerves that go down through that tunnel, which can be, the abdominal contents will create pressure on it because it's a normal sized tunnel with normal stuff in it, and then now you put extra stuff in it, and so now it's just fuller. And so it can create some pressure on that nerve and create irritation and create some scrotum change of sensation. But it's also common to feel that there's scrotal tightness associated with a sports hernia.